All right, welcome back to Echo Diabetes in the time of COVID-19. Thanks for joining in, and we're privileged to be here with Dr. Jay Shubrook, who's also on our faculty, and also has a great presentation available on our website. And we wanted to come back and kind of address some of the more timely topics and lessons learned from caring for patients with diabetes in the primary care setting in the time of COVID-19. So maybe, Jay, maybe I'll start off first with if you can talk about what role you think PCPs have to play in helping making patients with diabetes safe during COVID-19.
Yeah, thank you. And I'm so glad to be back with the Echo family. I hope you're all doing well. So absolutely, I think that we have such an important role. So many of us feel isolated. So many of us are relying on kind of, web-based sources of information. And again, I think as a primary care provider, we are the medical home for so many people. And I think it's important to remind patients that we're available. And we can be available a number of different ways. That could be virtually, phone visits, video visits, or in-person visits. And we now are set up to make it safe. And so it is actually, we want you to feel comfortable seeking medical care. We want you to know it's not the same as last March. We actually are prepared for you and we have safety features in place. I also think it's our job to share key things for our patients. And I think, here's a time where really we want people to keep up with their metabolic control. And again, reinforcing that, make sure patients keep taking their medicines, get their vaccinations, get their regular medical care, because we've seen in our practice, a lot of patients' A1Cs have climbed because they went 6 months with no care. And it's not that they didn't do their own self-care, it's just that it's much harder under these conditions.
And there's lots of various resources and tools out there. If, at least maybe for your practice or for kind of a busy PCP practice, are there maybe a top 3 or top 5 tools that come kind of top of your mind that, if you had to give some recommendations to point providers to during the time of COVID, or maybe there's some things that still apply to diabetes management that are basic, even outside the time of COVID?
Sure. So I would say, if you're trying to be universal, 3 places I might consider. Certainly go to the Centers for Disease Control. They have really good information all the way about for treatments, but all the way into social and physical distancing, into practical measures. I think the ADA has a lovely website focusing on COVID as well. So if patients want to get information or providers want to get information, there's actually forums that you could go to on the ADA and ask questions. And then at least here where we're at in Northern California, the California Department of Public Health and our county public health update regularly, and they let people know what's going on locally. And I think all of those have been really excellent sites for information as it relates to COVID and diabetes. At least the first 2 have diabetes specific. There is some diabetes information at the state, but it's more COVID related.
And clinics have been adapting and pivoting to do everything they can do and kind of learning on the fly. Can you talk a little bit about kind of your clinic in particular, of any kind of any resources to help meet the demand for diabetes self-management education, for remote monitoring?
Yeah, so there, I think that there aren't many good things that I think have come from COVID, but one of the good things is we've learned that we can really deliver quality care in a bunch of different ways. I have learned that I can have meaningful visits with my patients with diabetes, sometimes by the phone, but certainly virtually by video, and then also have ways to safely do it in person. So I think one thing is that using the tools that make telehealth possible is really important. And it looks like, at least for the foreseeable future, that this will be reimbursed. And so I think, again, whatever app you're using or system you're using, please utilize them. I think, you can make a nice connection with your patients. I also think that we really had to adjust how we were going to collect data. I think this has been really one of our biggest challenges. Some of our pump patients, they're able to upload into the cloud, but many of our patients who are just using glucometers, they weren't actually able to do that. And so We've done some workarounds where patients can bring in their meter maybe a day or two before. We'll actually download it, and then we'll have that data available for the time for the virtual visit. That limits the amount of time that a patient might have to be out in the public. And we also find ways to share data elsewhere. So we have a patient portal on one of our EHRs. And so we're actually able to communicate through that tool. And so I get all the information, the data per se, prior to the visit, but then we can really just focus on the patient at the visit. And I think cloud-based information or information asynchronously. And it's really, for me, now that I'm doing it regularly, I really have found I can have meaningful visits with my patients. I miss them in person, but I can still have good visits with them virtually.
Thanks for that, Jay. And thanks again for joining us for this program and for all your contributions and being a champion for people living with diabetes here in California, the state, and the world. Thank you, Jay.
Thank you. And thank everyone for all the great work you're doing. Keep it up. You're not alone.